The topic of our discussion in this lecture is the gluteal region. It is found in the lower limb. The gluteal region overlies the side and back of the pelvis, extending from the iliac crest above to the gluteal fold below. The lower part of the gluteal region, which presents a rounded bulge due to excessive subcutaneous fat, is known as the buttock or natus. The gluteus maximus muscle covers the anterior superior part of the emerging pelvis. The surface anatomical landmarks of this region include: as mentioned before, the buttock is the rounded bulge in the lower part of the gluteal region. The two buttocks are separated from each other in the posterior median line by the natal cleft, which begins at the third sacral spine and deepens inferiorly. The gluteal fold marks the lower limit of the buttock. Note that the gluteal fold is the transverse skin crease of the hip joint, and that it does not correspond to the lower border of the gluteus maximus, which crosses the fold obliquely downwards and laterally. Other than the cleft and folds, there is bony prominence in the gluteal region too. The ischial tuberosity is a large bony prominence that lies deep to the lower border of the gluteus maximus, about 5 centimeters from the median plane and about the same distance above the gluteal fold. It can be felt by placing the fingers in the medial part of the gluteal fold and pressing them upwards. The greater trochanter of the femur is a large bony prominence situated immediately in front of the hollow on the side of the hip and about a hand's breadth below the tubercle of the iliac crest. The iliac crest is a thick curved bony ridge felt in a groove in the lower margin of the waist. The hands spanning the waist are often supported by the iliac crest. The posterior end of the iliac crest is known as the posterior superior iliac spine. It lies on the floor of a dimple about 5 centimeters from the median plane and at the level of the second sacral spine, opposite the middle of the sacroiliac joint. The sacrum lies posteriorly between the two hip bones. The upper 3 sacral spines are usually palpable in the median plane. The second spine, lying between the two posterior superior iliac spines, is the guide to the other 2 spines. The lower part of the sacrum and the coccyx lie on the floor of the natal cleft. The small lower part of the sacrum is known as coccyx. It lies just behind the anus. It is slightly mobile under pressure. Lastly, the sacrotuberous ligament, which lies deep to the lower border of the gluteus maximus, can be felt by a firm pressure between the lower part of the sacrum and the ischial tuberosity. Now that we have gone through the surface anatomy of the gluteal region, let's talk about the fascial layers of this region. You may already know that the fascia is a thin casing of connective tissue that surrounds and holds every organ, blood vessel, bone, nerve fiber, and muscle in place. In the gluteal region, there is a superficial layer of fascia, and then there is the deep fascia. Superficial fascia is heavily laden with fat, more so in females, and is tough and stringy over the ischial tuberosity, where it forms an efficient cushion for supporting the body weight in the sitting posture. It contains cutaneous nerves, cutaneous vessels, and lymphatics. To understand the innervation of the cutaneous nerves, the region is divided into parts: upper and lower anterior, upper and lower posterior, as shown here. The upper anterior part is supplied by the lateral cutaneous branches of the subcostal T12 and iliohypogastric L1 nerves, while the lower anterior part is supplied by branches from the posterior division of the lateral cutaneous nerve of the thigh. On the other hand, the upper posterior part is supplied by the posterior primary rami of spinal nerves L1, 2, 3, and S1, 2, 3. Lastly, the lower posterior part is supplied by branches from the posterior cutaneous nerve of the thigh and the perforating cutaneous nerve. If we talk about the cutaneous vessels and lymphatics, the blood supply of the skin and subcutaneous tissue is derived from branches of the superior and inferior gluteal arteries. The lymphatics from the gluteal region drain into the lateral group of the superficial inguinal lymph nodes. That is all about the cutaneous nerves, vessels, and lymphatics in the superficial fascia of the gluteal region. If we talk about the deep fascia in this region, the deep fascia above and in front of the gluteus maximus, that is, over the gluteus medius, is thick, dense, opaque, and pearly white. Over the gluteus maximus, however, it is thin and transparent. The deep fascia splits and encloses the gluteus maximus muscle. Beneath the layers of fascia lie the muscles of the gluteal region that we will discuss in the next section.
Watch our medical videos anytime and anywhere. Download sqadia.com app now.